Welcome back, ladies and gentlemen in the room, and those of you joining us online. I'm Doug Busvine. I'm Politico's healthcare editor, and I'd like to welcome you to the first panel discussion of our healthcare summit. The panel is entitled, 2 years after a global pandemic, what's the diagnosis of Europe's health systems? And I'm delighted to say we have a full house on stage with me. I'd like to introduce our guests. First of all, allow me to introduce Andrei Klepikov, Executive Director of the Alliance for Public Health in Lviv. And delighted to have you here. Oksana Dementi, representative to the EU at the World Health Organization. We have Dirk van den Steen at DG Santé, and we have Maurizio Cecconi of the European. You're going to have to help me. I'm already going blank.
The European Society of Intensive Care Medicine.
Thank you so much. Thank you for helping me. Just to do some quick housekeeping again. Please tweet prolifically. Thank you, Natalie, for already tweeting. Using the hashtag Politico Healthcare. And as a reminder, you can ask questions only through the swap card platform, the instructions of which you can find on our website. If you're already on the platform, feel free to chat with fellow attendees and ask questions in the questions box to the right of the screen if you're on a desktop, and below the live stream on a mobile. And if you're joining us in person, Politico Live has provided you with flyers on how to use the swap card platform and ask questions. We're 1 year ago, we were in the midst of a pandemic. We had a keynote interview with Anthony Fauci, and he said he wasn't retiring until he'd beaten the pandemic. He has since announced his retirement, and of course we've had a dramatic development with the outbreak of war in Ukraine. My first question really would be to Andrei Klepikov, whose health NGO is based in Ukraine. What has been the impact of war on your operations and on the people of Ukraine?
Thank you. It's also important that this event started with the speech of the Minister Leshko. It was so powerful and strong. Just picking up some of the things he pointed, like over 1,000 hospitals were damaged and destroyed. This is an illustration how civilian infrastructure is affected. Looking at the territories, we have over 7 million war refugees left Ukraine, and about 8 million moved within the country. It's the largest move since the Second World War, and this means a huge disruption in human lives. Of course, the latest attacks on the energy sector are so scary, because in my home country, in Kiev, I'm like 50-50 between Kiev, the capital, and Lviv. I'm checking app with power cuts, planned power cuts for 8 hours per day. Like it's planned since 6 till 10 at the morning, and since 8 till 12 till midnight. This is an application to live in the capital with 8 hours before the electricity now, not in winter time. It's already causing a huge impact.
Thank you, Andrei. And could you talk a little bit about the different challenges you face in different parts of the country, and also the progress of the war? I mean, we started with health needs. You're an NGO that focuses on HIV, AIDS, and TB, but things have moved fast forward to today, and we're facing the prospect of an extremely harsh winter. I mean, how do you adapt?
Yeah, first of all, we are working shoulder by shoulder with the government and medical infrastructure. Example, on the occupied territories, all hospitals were destroyed, and people still need help. So civil society and community stood up and came with mobile clinics, for example. We used before just for testing, for HIV testing, but now demand is quite wide for full range of services, including measuring blood pressure, providing basic care, etc. So this is an example how we modified the services from hospital-based to be mobile and also more digital. All these people who moved, they're still using apps, chatbots, Telegram channels to get access to their medicines. And we are quite resilient. It's not only on the battlefield, but also in the medical and social sphere. When it was a difficulty for logistics to deliver medicines, for example, with our vans, we delivered TB medicines. When it was a shortage of fuel, we procured bicycles and did it by bicycles. So if it would be no bicycles, we will go by feet. But this is an illustration of the resilience, so we do everything to help people. And with the winter, it's getting more challenging. My feeling is that following the Stalin's organized artificial famine in 1933, when over 6 million Ukrainians was died, and it was acknowledged as genocide in many countries. Now Putin wants to kill civilians by cold this winter. It's really intentional strategy of the terrorist state and a crazy man on top of it. So it's critical to oppose it and not to be late. So now it's a critical time because it's getting cold now. So we are desperately need to add this humanitarian element to the health program we have to match and to get access to UN and other channels for the most vulnerable people.
Thank you. One further question. I mean, you've touched on these unprecedented movements of people within the country, out of the country, but also some people returning. I mean, what challenges do these movements pose to you? And you've talked about digital apps to keep track of people, but could you speak to that? And then I'd turn that to Oksana for a subsequent comment.
Yeah, we are very thankful to all states, EU states and other states receiving Ukrainian war refugees. At the same time, there are still a lot of challenges to get access to existing infrastructure because of the language barriers, disintegration, etc. So many people, even being in Germany or other countries, still keep in contact with Ukrainian doctors. And some of the regimes, especially for tuberculosis, are not so, well, TB is not a very big issue in many European countries, so some of the schemes even not available there. So many people are returning, but they don't have houses to return. They just run out of the money, cannot stay here, but they're returning to a desperate condition and now facing winter. So it's also really critical to support them with some basic support. We did a survey for HIV, the most vulnerable group for HIV. And before the war, it was 10 all HIV and health-related services. At the beginning of the war, it was evacuation and some other things. Now the top 3 is, first of all, access to food, basic need, access to warm clothes and be in warm, not to freeze, and third, mental health. I think everybody in Ukraine requires mental health support. It's just to bigger or smaller extent.
Thank you, Andrei. And Oksana, maybe you could address this from the perspective of the frontline European states, EU states. What's the picture from there?
Yes, thank you, Charles, and thank you very much for organizing this summit and put health in their attention in the European Union framework and here in Brussels, because what we feel at the beginning of cycle of neglect, and the biggest risk that we have now is that we forget the lessons learned from the pandemic, and we move into the next health threat without really addressing what we learned. So very grateful for you for putting health in the debate. And also, I was very glad to see Minister Lashko, even on the screen. We have met recently in a few international fora. And just remember, just before the war, our office has organized a visit for the minister and the member of Ukrainian parliament, and we discuss about tobacco control in Ukraine, and how to address also other health determinants of health. And just 1 month later, he was supposed to face so big challenges in the countries. But of course, WHO, even if we are more an organization that provides guidelines and standards, in emergency setting, we are very operational. So in Ukraine, we have scaled up our presence and at all level of organization. So our DG, our regional director, has been several times there. So we have hundreds of colleagues on the ground, and with the support of the European Union, we try and we have mobilized tons of supplies, of medicines, of oxygen, of medical kits, and really whatever was possible to bring this supply to people, we did. But as the minister said, the biggest problem is also to access new territories, new liberated territories, but also occupied territories, because we know that also the needs there are very huge. And one of the key messages that I would like to say is that the previous investment before the war in health system, give their return, because the health system, despite of all damages, delivering now services in Ukraine. And this is good, and this means that the investment in primary health care, the reform that was made before this war, so they bring the results. And of course, the pressure is very big, not only in Ukraine, where for us the biggest priority is to scale up humanitarian response, is to also, in parallel, also to think on how to rebuild the services that was damaged and how to recover also in the right way the health system. And one of the key messages is really to think that health needs to be in the center of the recovery, and it needs to be also taking into consideration the services that Ukrainian people need. Regarding the neighboring countries,
yes.
First, big gratitude for the countries for their big solidarity. So I think never Europe have seen such a solidarity as in this case, and we really positively impressed how people in European countries, also neighboring countries, open their doors to Ukraine, and this is very positive. And even now, after 8 months of the war, we still see the Europe quite open to refugees. Definitely, the health needs of refugees are high, and here I may say that according to our estimation, NCD is a big problem. Of course, the outbreak of some communicable diseases, COVID is still here, so influenza is here, and mental health. Accordingly, so the burden on health system in these countries is related to these needs, and we really see the need to scale up the primary health care services in many countries. And just today in the morning, I have read the report from Poland and Czech Republic. So the ministry is working with our teams and other partners. So they are looking on how to scaling up really primary health care services and also mental health services. This is really an issue. And what we are doing, we are training healthcare workforces on how to provide these services.
Fantastic. I'd love to keep this conversation moving along. So I'm going to turn to Dirk for a high-level view on the resilience of health systems in the face of this challenge. And also, I think what we will return to is the point around the return on investment in healthcare and how high that can be. So Dirk, over to you.
Thank you very much, and thank you for having me. First, also, thanks also because, of course, the Minister referred to the Medevac program, the Temporary Protection Directive, just to also relate to the point that was discussed, the tools we have and that we put at disposal to help and support where we can. Now, as regards the health systems and the question, where are we? Are they on the mend? I think first important commitment promise that the Commission made had to do with the Health Union.
Yes.
From September 2020, State of the Union address. And the latest news there is that on Monday, the Council, the Member States, they formally adopted the cross-border health threats regulation. Of course, we already had agreement on this regulation in June. But it really complements other key components of this health union, which was extending the mandate of the European Medicines Agency, dealing with shortages, looming shortages on the possible future health emergencies. I think in the ICU community, you are very well aware of the topic and the relevance of strengthening the mandate of the agency in that regard. ECDC for the surveillance, crucial. And then, of course, the cross-border health threats. How do we work with member states in the Health Security Committee? How do we trigger a health emergency? How do we exchange information? How do we facilitate stress testing? How do we do regular planning on preparedness? So a key piece of legislation, and happy that these instruments are in place at EU level.
If I might just
hoping not to use them too much, to be clear.
Would you say that the sort of toolbox is effectively now complete, or is there still work to be done? What would you say that the most important recent achievements are? I mean, as you say, you have a wider mandate for the ECDC and so forth, but where are your priorities going forward?
I think there were many lessons to be learned. I think, for instance, in June, so after the announcement of the Health Union in 2020, then a year later, in June 21, we came out with our first set of early lessons learned.
Yes.
And then basically, yes, part of the lessons is at the EU level, the coordination, the health threats that do not stop at the border. The other part was also really about the health system resilience. And that is one piece of the work we're still developing. And that already answers your question. The work will be an eternal work in progress to keep and maintain health systems resilient. In view of not just acute stresses, as we would call them, but you should also think of demographic aging.
Yeah.
So there is a broader picture when it comes to health system resilience. And one of those early lessons, lesson number 8, had to do with investing in health systems and using the Recovery and Resilience Facility and the recovery and supporting member states in using their national plans. So there, I'm happy to announce that for the 26 plans adopted by Council, we have more than 40 billion earmarked for investing into healthcare. About a third in digitalization, and I think that fits perfectly fine with enabling health information to flow better. Not just about improving, optimizing the way we deliver services to patients, but also it enables us with the basic tools to better steer the system at a higher level. But there's also more tailored specific investments in public health. So in that regard, we are monitoring it commission-wide with colleagues from ECFIN and SecGen Recover, and of course on the health side, DG Santé steps in. Yes. And we are monitoring the rollout of all the measures, the reforms, the investments with a horizon up to 26. Is there the work finished then? Well, we came out with our, what we always call it the spring package, communicating on the European semester and the recommendations we put forward. And there we have, in the latest batch, May, we had 8 countries that had a recommendation mentioning health system reforms. And if you look at the accompanying communication, it does stress that there is working complement to what the Recovery and Resilience Facility can do, notably mentioning the workforce challenge, primary care. Thank you.
Thanks, Dirk. I mean, I think just to sort of reflect for a moment, I mean, the challenges and the stresses and strains on frontline health staff in the healthcare workers in the last 2 years have just been incredible. And there's nowhere more frontline than the ICU, right? And, Maurizio, you have some very clear perspectives on how to keep staff, how to attract staff, and to make the job, something that is manageable, right? A job that you want to do and, deal with burnout. So, you've got a lot to say on this. I really look forward to your comments.
Lots to say and a lot to learn from the last 2 years. But let me start with the good news, because I just came back from our annual Congress yesterday, 5 days in Paris, and we had more than 6,000 people there, which means that the intensive care teams, they work very hard. We didn't meet for 3 years, and it's been very tiring, but we are still eager and with the enthusiasm to go forward. However, I think it's important to talk about the lessons learned, because the pandemic has shown how frail our healthcare systems were. And I think it would be important and honest to say that we were not prepared. I don't think we were prepared well in any country in the world. I traveled all the world, and I speak with colleagues from all over the world. The pandemic put serious challenges everywhere. And I think there was a narrative at the beginning that maybe put the wrong focus. It is true that we struggle with ventilators, we struggle with drugs at the beginning, particularly with personal protective equipment, but that problem was sorted out pretty quickly, and also with the help of Europe and so on. But one thing that I keep repeating to everyone, and I think it applies to different fields of medicine, is that a ventilator is not an intensive care bed. An intensive care bed is a group of competent people working together as a team. And I think if you ask me what have been, for instance, one of the most important responses that we've done together with the European Commission, we decided to invest in training. And impossible to train specialists between a first wave and a second wave, but you can do some training to help healthcare workers, maybe not working regularly in intensive care, to be better prepared. That was not just to give some clinical and practical skills, was also to give them a degree of psychological safety to fit better into our teams. The best feedback was receiving thank you letters from ICU teams and healthcare workers say, I feel much better now in this team. And leads me indeed also to, and I'm very happy that we talk about mental health here. Mental health will be very important for the public, for the citizens. The WHO is putting a lot of focus over the next years on mental health. But let's remember that healthcare workers are also people, and they also need their mental health looked after. It's been very tiring few years. We know that there has been a lot of burnout in hospitals, in teams. And so it's important that we find ways to look after the healthcare workers, to look after who needs to look after. Also because, just to give you some numbers, the crisis for not having enough beds in Europe was a crisis before the pandemic. We know year on year you're probably increasing the demand for acute beds in hospitals of about 2%. This is due to aging population, to amazing progress in research, therapeutic options, but these therapeutic options means that you need an acute bed, you need an intensive care bed maybe for some days to be able to recover and to move forward. So the good news is that I think with forum like this, and now also at the European Parliament, there is an interest group that talks about intensive care. So there is a European Parliament on intensive care. We think that that's refreshing. It means that there is a voice for patients and families, first of all, and then for healthcare workers to talk about what matters, in these things. Also because we are a very intense specialty with a lot of technology. Sometimes we are called extensive care, expensive care, but it's a very cost-effective care. If you put the right resources, very intense, at the bedside, technology, human resources, and also how we rehabilitate very early these patients, how we help them to recover also mentally, we know that they can go back to work earlier. If you have spent 2 weeks very sick in intensive care, working age, 6 months later, you may not be able to return to work yet. These are important reflections for our societies, because if we do our job properly, we can help society also to be more productive and to recover better.
Thanks, Maurizio. I think that point about the return on investment is a very compelling one. I wanted to also particularly ask about not just about retaining people in the healthcare profession, ensuring that they're mentally well enough to continue the task, but what are your views about recruitment and training? Do you think things need to change here to attract the right people to?
So I think we are a very attractive specialty still. The fact that we're meeting so many in these days show that people are still there and they want to be there. However, we also have to realize that the generations are changing. The time where we all said, I don't know how many doctors are in the room, but we like to take pride in the fact that we were training for 90 hours a week and working every single weekend, and we take a lot of pride with this. But the new generation is asking different things. We need to listen to them. We don't have to criticize them, So we need to find ways also for the most intense profession, not just for intensive care, but emergency medicine, all healthcare, I would say. We need to find ways to bring also work-life balance. And in this, I am very confident that research and disruptive technology would help. We are not just going to put money into this and expect that we can meet this demand if we don't change the way we practice. I'm sure that there will be robots, there will be artificial intelligence, there will be new ways of working. We need to find technology that makes the work of healthcare workers better for the patients. There is a quote by a book of Eric Topol on artificial intelligence that says that he hopes that artificial intelligence will let more time for healthcare workers to be spent at the bedside with the human relationship that we need. And going deeper, also in this human relationship with our patients, is probably also one of the keys to look after our patients and also ourselves. It's not detaching from them, it's be able to go deeper. But we need time to do that, and that's why I think technology, maybe robots in the future will do some of the heavy tasks. It's a revolution that we need to start now. The crisis has shown how frail we were, but was also a reflection, and it's a massive opportunity for change. We have changed a lot as a society. We've seen that we can do a lot, for instance, also with educational programs on mental health and how to look after people, but I think we need to do more.
Thank you. I would like to, Andrei, yes, and then I think Oksana would be.
Thank you. Yeah, on return on investment, actually, in my area, HIV and TB, there was a huge fear that at the beginning of the war, in March and April, that it would be outbreaks in HIV and TB. And it didn't happen. This is an example of return on investment made in the government and in civil society, because initially when the war started, every service dropped out significantly. But then we renew, and we are continuing now to serve over 300,000 people, the most vulnerable to HIV. So, and TB. This is an example how resilient can be system be and how important EU and other countries' investment to keep the health level and health services functional.
And if I can just make one very short comment on that, I enjoyed very much what Natalie was saying before about research. Remember, we have been able to respond with so fast with the development of vaccination due to the research done before. And for clinicians at the bedside, one of the biggest returns on investment in research has been the research done through recovery and REMAP-CAP. REMAP-CAP is a consortium that was funded also by the European Commission, by the European Union. And this consortium was a platform that was invented some years ago for a possible pandemic. So the vision to have an infrastructure for research that would answer to a pandemic was the reason why we were able to do that. If you have to start in the moment of the crisis, it may be a bit too late.
Oksana, I think the people and dimension of the resilience is not only confined to the EU. It's a wider European issue, and there are frontline states of the West Balkans and so forth that also have to work on their resilience. I mean, what's your perspective there?
Yes, thank you. First, speaking about workforce, from our perspective, indeed, the workforce is the key of pillar of health system. And what we found recently through various studies, also the global level and regional level, that indeed almost every country have a shortage of workforce. Even the most developed countries and particularly less developed countries who are training a lot of workforce, and then the workforce leave the country toward the most developed countries. Also, just in September, our regional office for Europe launched a report, and I just want to invite everybody to look at this report, workforce, status of workforce in Europe. It's time to act. So, and of course, what we identify there is that we have a workforce that is overburdened, that is burnout on the pandemic, that is very demotivated due to the big burden on an workload. The policy recommendation was really to invest in workforce, to invest in the retention of workforce, to invest in their conditions, to invest in their salary. So this will be the key recommendation, and also for countries to plan and to manage the workforce planning, because also in many countries we found that we have an aging workforce. So, I think in 40% of European countries, we have workforce that is older than 55 years. So, and we really need to invest in workforce.
Absolutely. Dirk, you would like to add your view?
Yes. First of all, indeed, to confirm the observations shared, when we published last year our companion report that goes along with what we call health profiles on the state of health in the youth cycle. And this basically is, if you like, a diagnostic of national health systems. We noted that 15 countries flagged workforce shortages as a key challenge. That's not probably more flagged them as a challenge, but 15 flagged them as a key challenge. And also the importance of peering into the future intelligently. I'm happy to say that we will kickstart a joint action with the member states on workforce planning, and obviously what is the role of digitalization and to which extent does it complement, substitute, is part of workforce planning. Thank you.
Great. I appreciate your comments. And we're into the last several minutes of our conversation, so I'd like to turn things a little bit more to look forward towards recovery. But first of all, we have a question from the floor, from online. Theodoros Dimopoulos asks, according to the speaker's points of view, which is the main lesson in terms of strategic approach that the pandemic has taught us? Strong investment in public health care and public health, social care services focusing on the community, or a more lopsided approach through private sector involvement, taking into consideration the danger of demand inducement? I think that's creating supply to create demand, if I understand the question rightly. We'll start with Maurizio.
So it's a great question, and I think it is one of the lessons we need to everyone, from the hospitals to the public and the public health, to understand and to work together in a concept of health as a continuum. It's not just, preparing more the hospital or just doing more public. It is a continuum. And we need also to involve, I think, the public more in this. I speak for intensive care. Intensive care units were working before the pandemic and they will work after the pandemic. One of the major challenges is also the fact that we will have more infections like pneumonias, antimicrobial resistance was there already before the pandemic. I don't think there is enough awareness of this. We need to help, because if you recognize some of these infections early, the same way cardiology has done with heart attacks, the same way neurologists have done with strokes, then I think we can all work together with faster recognition, better prevention, and then we come to hospital. But the key learning is focus on people, focus on education, focus on attracting and retaining people in our healthcare systems. We have to do it now, not during the crisis. If we do it now, we will be better prepared for the next crisis.
Thanks, Maurizio. Dirk, I think it's about being smart and prioritizing. How do you see the views, in terms of cost-effective interventions? The best way to get the return on that investment in health.
First, I would like to echo what was said. we've been supporting and advocating integrated care for years at the Commission. When we look at this, how do we assess this? We look, for instance, at rates of avoidable hospitalizations. What is the role of the GP in the health system? This is a big one. We also had a joint action on digitally enabled care. Again, the digitalization, the technology makes it possible to use the information to optimize across the continuum, for sure. And then we're talking really about the care delivery itself. When we talk about the health security framework and all this public health investments, then I would like to invite you all to attend the conference in Luxembourg, organized by the European Commission and the Luxembourg's Ministry of Health, 22nd, 23rd of November. This will be on COVID lessons learned, which I think is very topical, germane to the panel. And it also will be about the way forward with the EU-level health security framework. Participation can be online. You can register for free, but of course, as always, the number of attendees is not limitless.
So book early to avoid disappointment, with a request for a short answer. I mean, in the broader context, Oksana, where do you see the path to recovery and the priorities there?
I think our Director General, Dr. Tedros, during World Health Assembly in May, have outlined the priority for WHO, but also for the entire world. And he outlined 5 key priorities. First is to invest in promotion health. So these we consider that is most effective things to promote and to invest in the root cause of the diseases. Second is to provide health. And when it comes to provide health, the most effective investment is to invest in community services, in primary health care. And the biggest lesson learned from the pandemic is that the country who invested in primary health care have resisted better and succeeded better than the country with the most sophisticated healthcare system. So investing in primary health care, universal health coverage, this is the second area of investment. Third is protecting health. So investing in a strong global health architecture, regional health architecture, so in preparedness. And here our director also came with 10 recommendations for improving global health architecture.
We're running short of time, so thank you, but I'd like to give Andrei the last word because it must be so difficult to be positive and optimistic in such a tough situation. So how do you think about the future? How do you plan for recovery?
Yes, thank you. I also would like to combine it with the lessons. One is quite common from COVID pandemic and the war. We need to speed up decision making. The decision which took to take years, we are taking in days. Months, we are taking in hours. And Minister Leshko is a great example of this. This is a message to all policymakers. Second, it's really showed that civil society plays a bigger role than it was thought initially, sustaining healthcare, but also bringing humanitarian element. Unfortunately, share of humanitarian support to civil society is still very small. It's 0.1%, the smallest in comparison with any other sectors. If someone asked to me, we are serving 300,000 people, asking for food and bread, I cannot say, sorry, I have just condom for you. We have to be relevant, and we shouldn't say no in the context of war and humanitarian crisis. So it should be access to low threshold humanitarian aid. And finally, rebuilding. We are optimists in Ukraine. We have no other alternatives. This is the war not against Ukraine. This is the war against fundamental values and principles we all share. So we don't have alternatives. We need to win this war, and we will win this war. But for this, we already started to think about rebuilding. And it's not returning to the past. It's not reconstructing what was before. We need access to new medicines, like long-acting ARVs, long-acting PrEP. We don't have it in Ukraine, but we need in treatment of NCDs, in mobilizing and digitalizing healthcare. This is our future, which starts today, and we need focus on this.
Great. I'm getting people talking in my ear saying we're out of time, but to sum up, it's terribly important to invest in resilience, and the return of investment is great. People, healthcare workers, and the mental health of the healthcare workers is terribly important, and we need to sharpen up our decision-making and speed up. So thanks very much, everybody. We'll wrap this session up. I'd like the audience to stay seated while we get set for the next session. This is the Politico Live Healthcare Summit, coming to you live from Brussels. See you soon. Thank you.